I'm here with John Hughes, and he is a patient that I've been working with through care coordination and integrated case management as its lead coordinator. And he is going to share with you a little bit about how he feels that this initiative has changed his perspective. And,
tremendously so.
And how it's changed his life.
And it has, indeed.
Yeah. So I'm going to let John take it away.
Thank you, Don. First of all, I am a beat-up vet. I have a number of health issues, a long list, and injuries as well. And I want to make sure everybody understands that I'm a multi-issue, multi-injury VA patient, and it's written from my perspective and what it was before and what it was after Don took over my lead coordinator case management efforts and helped me get the right type and amount of care I needed from the VA. Anyway, let me begin here. Further, I read kind of slow, I hate to say, because I'm kind of freaking blind. So I read like a first grader now. Anyway, the purpose of this video is to help the Leavenworth VA to better understand and to better treat VA patients dealing with the significant challenges associated with multi-issue and or multi-injury health problems by providing these multi-issue patients the assistance and support of a VA assigned lead coordinator case manager through the care coordination and integrated case management office. Now, before I present my case in support of this proposition, I'd like to tell you how much a VA assigned lead coordinator has helped me as both a multi-issue and multi-injury VA patient. Since Don Klaus, sitting to my right here, became my VA assistant lead coordinator some months ago, every aspect of the myriad of difficult and confusing challenges that I have been facing within the VA for so many years, since at or about 2008 timeframe, immediately became resolved, organized, synchronized, and then working smoothly and all in concert, all in a concerted effort rather, focused on helping me, okay? And that's the damn truth, okay? Let me turn the page here, okay. Now this overall effort by Don Klaus included managing and coordinating a wide array of doctors, specialists, and clinics who then started examining me as an informed and integrated team, where they then began working on my many physical, medical issues, including my many mental health concerns, into their overall combined and integrated treatment plan. Simply stated, Don Klaus added and coordinated a complete range of new doctors and new clinics, along with my existing slate of physicians and clinics, to begin jointly attacking my numerous and severely chronic medical issues in an organized and combined arms-like campaign against my very long list of physical health and mental health issues. Now, the reason I use this phraseology like joint and combined arms campaign is because that's exactly how our own U.S. military forces as a whole fights against an extremely complex and capable enemy force. Let me see what I'm doing here. Without presenting a lengthy explanation of what U.S. joint and combined arms operations actually look like, it's simply using the various branches within our own U.S. military services of the Army, Navy, Air Force, Marines, and our Space Force into a singular, focused, multifaceted, orchestrated, and combined effort, all converging in a singular, synchronized operation to defeat a very complex and capable enemy force. And that's pretty much what Dawn did for me with all the doctors, clinics, specialists, you name it. She combined them all. First of all, she got them all, the ones that I needed. She knew what my injuries were, what my issues were. She got the folks that addressed those things. She brought them all together, coordinated them, and they started attacking the top priorities first, okay? That's what she did for me. And she got me better, by the way. A lot better than I was, that's for damn sure. Anyway, let me get back to the reading of this long-ass statement. All right. So what did my VA lead coordinator, case manager do for me in specific? Here's an abbreviated list. First, after gaining a full understanding of the details and depths of all my related issues and injuries, she then added the appropriate physicians and clinics necessary to address all of these specific issues. She then began the referral process to get me the appropriate appointments with those specific doctors and clinics, some of which were new to my existing list of doctors and clinics. She then deconflicted my VA medical appointment schedule, giving priority to the most critical of my various health issues. And she went about it in a really smart manner. You'd be a good battlefield commander, by the way. All right, you think about that. Now, she coordinated with each of these physicians and clinics to ensure that I was getting the appropriate and necessary testing, imagery, treatments, and medications to effectively address each of my many specific health issues. She met with me at least once a week via VVC to monitor my ongoing progress, to address my concerns, to share my ideas and hers, as well as treatment strategies, and then relayed all that information, ideas and treatment strategies and other information, to my physicians and their clinics as appropriate. Most importantly, she continued to work with my related physicians and clinics to ensure that the individual treatment plans were consistently integrated into the overall and combined treatment plan, with the most critical elements put in priority in my appointment schedule. She very kindly arranged for some interim treatments to help me ease my chronic pain in the interim period while I was waiting a few months, like 6 months or more, to undergo my upcoming spinal surgery, which is a spinal fusion. And I'll specify the pain relief treatments and some of the mental health that she provided me that enabled me to make it through those 6 months. I'll provide that later on in this statement here, okay? Now, to better care for multi-issue VA patients, we need to understand what they're really up against. The primary difficulties and challenges for VA patients with multiple health issues and or multiple injury issues begins with the VA appointment process, which can be difficult, especially if you're blind and you can't use the VA My Healthy Vet website. I can't see it very well, I really can't. So you have to use the phone or have someone help you. And that's the kind of situation that I'm in. I couldn't see what the hell I was doing. Anyway, it can be a significant challenge for any VA patient, regardless of whether you're a multi-issue patient or not, to make and receive a timely appointment with your primary care manager, PCM. But for the multi-issue and or multi-injury VA patients, the real problem is the limited time available for the doctor, the PCM, and where did I leave off? And the doctor and patient interaction within a typical 30-minute VA appointment timeline. okay? Usually there's only like 15 minutes remaining in a normal 30-minute appointment after your PCM goes through all the preliminaries with you. For example, going over your vital signs and your A1C, etc. Okay, conducts your initial physical exam by listening to your heart and your lungs and looking into your eyes, ears, and down your throat. Goes over your related lab tests results, goes over your related imagery results, and your PCM may then go over and modify your related medication list, which in my case is extremely long. You should even see the medication list that I no longer take. It's even longer. I've been on so many things. Incredible. Anyway, therefore the multi-issue injury patient typically doesn't have enough time to adequately address and update their PCM with their very long list of already known issues, let alone having enough time remaining to then adequately identify and explain any new issues for their PCM to then examine, document, and medically address. Okay. Consequently, many already known issues and/or new issues aren't brought up to the PCM during their short appointment window, and because of that time limitation, there are those unreported issues that aren't adequately documented and aren't adequately addressed by the PCM, at least not until those particular problems, one, some, or all of those unaddressed issues have since become so obviously apparent, and possibly even until they've become chronically severe. And by the time that happens, these previously unaddressed issues, which could have been much more easily treated, nipped in the bud, if you will, if they had been caught and treated early enough. However, the longer that these unaddressed issues go untreated, they typically require significantly more invasive, expensive, and extensive efforts to properly address and effectively treat. Okay? Now, and for some of those previously unaddressed issues, such as dangerous stuff like cancer or diabetes and/or heart disease, and I'm sure there's some others, those kinds of issues can be permanently damaging, debilitating, and even deadly if they're not caught in an effectively addressed in a timely fashion. Okay, and regrettably I've seen that happen, not to me, but to some other folks. Now, for all of the health and injury issues that the PCM does identify, document, and address, each one of those issues requires its own individual treatment plan. But for multi-issue injury situations, for one VA patient with so many different and unique individual treatment plans, they can become extremely challenging for that patient, but also for their related PCM to effectively integrate and manage all of those individual treatment plans into a single overall treatment plan for that particular patient, and focusing on the priority issues on the top there, okay? This is especially true if the VA patient has a very long and complex list of ever-evolving treatment plans. Okay. Each of their multiple issues and injuries where the competing priorities for testing, referrals, treatment, rehab, and/or follow-up get too confusing and to effectively integrate and manage as these conditions continuously evolve. Okay, you can get worse, you can get better, the situation can evolve over time. New things can come in, some things get cured, they go out, priorities change. You got to manage this. It's difficult. You got to look at it on a continuous process. It's very hard for that PCM to do that. Okay. The complexities and challenges only increase for those multi-issue and injury patients that are also suffering from the horrific effects of what's called a chronic pain cycle, where the chronic pain causes and amplifies chronic sleep deprivation. Trust me, I know this, I've experienced this, which can then cause and amplify the patient's related mental and emotional issues, such as severe depression, anger, and anxiety, okay, of which, trust me, it's a cycle, and it's a clockwise cycle where the pain, chronic pain, contributes directly and feeds and amplifies the sleep deprivation. And if you lose enough sleep, it definitely, along with that severe chronic pain 24/7, can affect your mental health to a significant degree. It'll ruin you as a person, trust me. Of which then makes you feel sleep loss, and you feel bad. It amplifies the pain, which continues to amplify this crazy circle, okay, this crazy, endless theme park ride from hell, okay? It's awful, and it will ruin you, and you can't get off that ride until somebody can help you with the pain, okay? Now, regrettably, the only effective way to break this ever-worsening chronic pain cycle is the chronic pain, the sleep deprivation, and the mental health deterioration, is to first defeat the cause of the pain. Now, this does not mean that you can't treat the sleep deprivation and treat the mental health issues while simultaneously trying to treat the pain. But in order to permanently break this cycle, the causation of the chronic pain must be defeated first, and that's no lie, okay? It happened for me with a fantastic back spine surgeon named Dr. Ohio from Kansas, University of Kansas Medical Center Spine Clinic in downtown Kansas City, Kansas. Great, he saved me, truly. Okay. Now, regardless of how many individual health issues, injuries, issues, or mental health issues a multi-issue VA patient has, priorities must be made for the most critically serious issues for any patient. Although multi-issue patients may have significantly chronic pain and suffer from that horrific pain cycle that we just described, if they are all also a heart patient, for example, with significant cardiac concerns, then obviously the priorities of treatment need to be made for the most life-threatening problems. Okay, so just keep that in mind, because anything can pop up at any time, and you may have to change your focus and your priorities based on what's currently happening. Okay. Now that doesn't necessarily mean that some issues can't be treated concurrently rather than just sequentially. Okay, those kinds of decisions and coordinations need to be made by all the doctors and specialists and related therapists and what have you, working on these many issues in concert with the multi-issue patient and the VA assigned lead coordination case manager. Okay. Now, in fact, these kinds of critical decisions and related coordination necessary in developing, integrating, and maintaining an overall combined treatment plan for these kinds of multi-issue patients should always be made with the assistance of that patient's VA assigned lead coordinator case manager. Okay. Regrettably, not every medical center has a dedicated lead coordinator, case management office. In fact, this particular Leavenworth VA Medical Center did not have a dedicated lead coordinator case management office until Don Klaus volunteered to become my case manager. Now, before I explain how and why Don Klaus volunteered to become my case manager, lead coordinator, case manager, I need to explain what a multi-issue VA patient looks like. Now, my health issues include, and this is just the health issues, not the injuries. I have migraine headaches that resulted from a hit in the head in Iraq. I have debilitating fainting spells, severe glaucoma with very low vision remaining, all the way blind in my right eye, regrettably. Hypertension, high cholesterol, an underperforming thyroid, early stage kidney disease, kidney failure, severe neuropathy in my feet, from the knees down in both legs and in both hands, so from the wrist down. I have pre-diabetes. I have poor vascular circulation in both legs, chronic leg swelling as a result. My service-related injuries and related mental health issues include right side head concussion, right eye trauma with multiple eye surgeries to try to save the sight, which they tried, but it didn't. Right maxillary sinus trauma with impacted right sinus and related surgeries. What's this one? Integrating impacted right sinus. I probably should have said including impacted right sinus and related deviated septum, cervical spine trauma, C-spine now totally fused, my neck's totally fused. They took a number of operations to do that. Somebody's at the door. You want to stop and get the door? No? Okay. You can edit this out. Right shoulder trauma with multiple repair surgeries, right elbow trauma, right hip trauma, scheduled for hip replacement surgery, right ankle torn trauma, torn interior ligaments. Corrective surgery is not possible due to my poor leg circulation. Podiatry issues related to the injured right ankle. L4, L5, S1 fusion due to a degenerative disc related to an old low back trauma. Vertical fractures in surgical extraction in the top left back and top right back molars from severe jaw clenching due to severe chronic lumbar and sciatic pain. Chronic sleep deprivation due to years of severe chronic pain, severe chronic depression, anger, and anxiety due to severe chronic pain, and in concert with severe chronic sleep deprivation. And that's all related to that pain cycle I talked to you about. And last and not least, I have PTSD. Now, most people would consider going blind to be kind of a curse, but for me, it was actually a blessing in disguise, because had I not been having low vision problems, Don Klaus, as the VIST coordinator for the Leavenworth VA, she would have never come to know me and become aware of my many physical health and issues, and my many service-related injuries, and my many related mental health issues. Had Don Klaus not personally observed all of my challenges due to my extremely debilitated conditions, situation, she wouldn't have volunteered to become my VA case manager. She, to assist me and assist all my related and non-VA physicians, my VA and non-related VA physicians, to assist and developing, coordinating, and maintaining an integrated overall treatment plan, which continues to effectively address all my priority issues while also working in secondary issues as appropriate. Okay? I'm still getting some of my minor stuff worked on when time's available, when other things don't have priority. So she's hitting on all cylinders for me, Dawn is, okay? Given that the care coordinator and integrated case management is a new VA initiative, and it's in its infancy at the Eastern Kansas Medical Center here at Leavenworth. Dawn has should not only be recognized for her outstanding performance of duty, but also for her incredible compassion, caring, and kindness in volunteering to help me. And by doing so, she truly has done such an amazing job in assisting all of my healthcare physicians, specialists, and therapists in providing me such outstanding and much improved, there's no kidding about that, medical and mental health care from the VA especially, okay? This also includes VA community care and just my own Army health insurance, TRICARE insurance, and Medicare insurance that gets me civilian doctors like Dr. Ohio at KU Med Center, okay? Anyway, before Dawn became my VA lead coordinator, getting the right referrals and the right testing and the right diagnosis, the right treatment and pain relief was extremely difficult and enormously challenging for me to receive. In fact, before Don Klaus became my lead coordinator, I felt as if I was fighting the VA to get the help and care I needed. However, after Don became my lead coordinator, case manager, I felt as if the VA was actually fighting for me in unison, okay, no less, in a unified effort to get me the exact type and amount of help and care that I desperately needed. And Don, thank you so much for that. You actually no shit made that happen. So God bless you. Seriously. I can't thank you anymore. I'll never be able to repay you for that. Further, while I was waiting for my lumbar fusion surgery at KU Med Center to finally receive the necessary surgical solution to effectively address and end my severely chronic low back pain and my sciatic nerve pain and that doggone pain, that terrible pain cycle I was talking to you about. Don Klaus helped me get some intermediate pain relief and mental health assistance until my spinal surgery date was actually came, which was this last May 9th of this year, 2024. But it was a 6-month wait to get that. Don helped me deal with my severely chronic pain by getting me referrals and very effective treatments with these very necessary clinics and physicians below here. She sent me first to the VA pain management clinic, and they did great things for me. Where they got me. When I arrived there, they gave me, the VA pain clinic gave me a genetic blood testing, which determined what particular medications were effective for my particular genetic type. And some of the stuff I was taking was deemed not effective. Some of the stuff that I was taking was actually causing more problems for me in other areas. So they got me off some of the pain medicine that wasn't working for me, and they got me on some synthetic stuff that does, and it really helped me out Didn't address my nerve pain, but all my other boo-boos felt a lot better, trust me. Okay. She sent me to the VA pharmacology clinic, where they went over all my meds and saw which ones needed to be adjusted and got rid of, and the ones that I needed, and whether any of them had any bad interactions, because I had this huge long list of medications. She sent me to the low vision clinic, where I got a number of tools and training to help me see better and understand better and live a little bit better quality of life, even though I can't see very well. She sent me to the VA physical therapy clinics, a number of them, where they gave me dry needling and VA acupuncture. She sent me to the VA dental clinic, where they surgically removed my broken molars that I clenched too tight and broke my teeth. She sent me to the VA muscular clinic, where they gave me VA Botox injections to help me with my migraines, and they really helped me out. That was really good stuff. I'm still taking it. She sent me to the VA neurology testing, where they're doing all kinds of tests, trying to figure out what's going on inside my head with these very strange fainting spells that keep coming, and they're not quite figured that out yet, but they're working on it. She sent me to the VA endocrinology, where they found a number of issues what they're helping me with underactive thyroid and a little bit of pre-diabetes medication. She sent me to the VA mental health clinics for a number of anger management and communication and peer management counseling, all very necessary and helpful to me. She hooked me up with online or VVC, VA Whole Health, and that provided mindfulness briefings, as well as a VA VVC yoga for disabled folks. And that would actually help me relieve a lot of my pain, believe it or not, the stretching of those muscles that were continuously spasming due to the related nearby pain. And that helped end some of my cluster spasms up and down my body. It was very helpful. So she also sent me to the VA community care for steroidal lumbar injections into my bad places in my back. But some of those shots initially worked like a champ, and then they wore off, and even the second and third iterations of them did nothing. So we had to shoot for the surgery. Okay. And she also sent me to the VA Community Care Aqua Physical Therapy to strengthen my legs a little bit and my core muscles, so that after my surgery, my back surgery, that I would be more fit and able to start the spinal surgery related physical therapy post-surgery, so that I didn't go in there so weak. And that really helped me out. I got a pretty good jump start on my physical therapy as a result of that. So she was always doing forward thinking, not what's going to just help me now, but what's going to help me down the road. And so she's a very, not current thinking, but also forward thinking, looking over the horizon, what can I do for this guy? And that's another reason why you'd be a great battlefield commander, Don. And she also sent me to the VA community care for mental health counseling. And that's been very helpful via VVC. And anyway, given the amazing success of my lead coordinator's outstanding efforts in my behalf, the Leavenworth VA should expand its new case manager's office and use Don Klaus to train and develop the other newly assigned case managers, lead coordinators, what have you, to assist other multi-issue patients just like me. Okay, and there's a bunch of them out there. I know a lot of them personally, and they have the same pattern of experience that I do of frustration and difficulty. And had they had someone like Dawn, they would not have languished so much in pain like I did until she jumped in and basically saved me. I'm not kidding, she saved me. Okay, that's a fact. Okay, now, given all that, if in fact it was actually technically feasible, what the VA should do, and this is kind of a joke, but I mean it sincerely, that what they should do is they should clone Don Klaus and then issue multiple copies of her to every VA medical center on the planet. And that's no kidding. If there were more folks like Don, there'd be a lot less messed up patients like me. And God bless you, Don, for doing what you did. And I hope you are successful in training and developing other lead coordinators and case managers such as yourself. There's a lot of vets like me out there, and they need your help, seriously. Okay, this basically completes my advocacy and support for further implementation and expansion of the care coordination and integration case management office here at the Leavenworth VA, in order to provide better care and treatment to and for multiple issue and multiple injury VA patients. I have some other ideas that I can present later, but I'm not going to go into them now because that's basically the mission
Yes.
as stated. We wanted to
So,
advocate and
yes.
leave it right there. We don't want to further address some other issues.
Right.
But I have
So-
some ideas.
So I have some questions.
Yes, please.
So, what would you say that lead coordination did for you, like, prior to, maybe during, and how you are thinking it's gonna be when we're done?
Well, here's what I'm thinking when it's going to be done. That integrated treatment plan, where the priorities are being addressed, okay? Because we've already fixed some of my problems, and so those priorities have fallen off, okay?
Yeah.
Do I still have some pain issues? Yeah. Are they chronic? No. Do I still need some pain medicine? Yes. But do I need the help of all those injections and all the stuff that you were doing for me to help me get to that surgery? No, I don't necessarily need all that anymore. So some of that can fall off, okay? Do I still need my hip replaced? Yeah. Do I still have other injuries that need to be readdressed? Yes. But the end state for me is, I know I'm going blind, and I know I'm depressed about that too, by the way, but my quality of life has significantly improved. I had lost all hope of ever being able to have a day where I had a break from 24/7 pain and was able to actually go to sleep like a normal human being, and it didn't take 72 or more hours, and that's the God's truth, for me to be exhausted enough to actually fall asleep for 2 or 3 hours, seriously, because the exhaustion had overridden the pain, okay? I did that for years, and it ruined me mentally and emotionally as a human being, and my behavior was awful. Now, I am now making amends with my family because my behavior is no longer awful. I'm not, how do I put this? I'm no longer a crazy, irrational a-hole, okay?
That is good.
I'm just a regular old a-hole, okay?
So how do you feel like it looks different from before, and you trying to navigate with all of the different clinics and providers and stuff like that? What does that look like?
Well, what it looks like, you know that I advocate for myself
You're
sometimes.
very good at it.
Okay, I try to leave my poor wife alone and having her do all the stuff on My Healthy Vet or call I try to do most of that myself. However, when I'm having difficulties, I know I can call you, and I know when we do our weekly updates on via VVC, you always ask me how I'm doing, what's going well, what's not going well, what do you need, okay? I always tell you, and you take care of it, okay? I know I can depend on you to keep doing that for me as necessary, but now that I'm feeling so much better, some of this I can do myself.
Yes,
okay, you're helping me get back to where I can actually function mentally and emotionally without the little slight frustration or slight issue or slight bump in the road. I couldn't manage my temper. Okay, I could not manage myself. Now I can, and I have since apologized to a lot of people I blew up on the phone, by the way. But and they were just trying to do their job, and I wasn't getting what I needed, and I kind of got out of control. It wasn't pleasant to them. Okay.
How many providers do you think you were trying to communicate with by yourself before we started working together? How many clinics or departments? Just take a guess.
Well, all of them. I did one thing. I didn't know what y'all had. Okay, I did not know y'all had. I did not know y'all had a pain management clinic. I did not know you had a pharmacologist that would help me manage my meds. And make sure that I got the right one. I did not know they had a genetic blood test. I did not know they had all the things that helped me survive the last 6 months, keeping sane enough where I didn't hurt myself. You understand what I'm trying to tell you here?
I do.
You helped me get there. You helped me get to the finish line. If it you were my lifeline. I can't explain it. It was awful. Help me make it. and I feel so grateful. I have my life back. I had lost hope of ever having a good day ever again. It was ever a worsening situation with that crazy chronic pain cycle. It was killing me. Sorry, I'm getting upset, but it's true. I used to think I was a tough guy, but man, that pain cycle thing will lay you to waste. I don't care how badass you think you are. It will ruin you, and when it won't stop, and you can't get it to stop, and there's ever worsening month after month. All you think about is, how do I get this to stop? And some bad thoughts can creep into your head, I'm sorry to say. So, anyway, I don't want to talk about that. I want to talk about going forward. And so I am going forward. And the better I get, the more I can do for myself. And
Absolutely.
The better quality of life I have, and the better mood I am, and the better person I can be. And so you did that for me. And so I want that. I know there's other folks out there like me, other veterans. I know they are. I've seen them. I talked to them. Friends with some of them. And they need somebody like you. So the VA, not just here, but every damn where, needs to find people with the kind of heart you have, the kind of knowledge and get up and go that you have, Don, and the folks that know and understand how to work the system, talk to doctors, talk to therapists, talk to specialists, understand what capabilities are in fact out there, and compare them to those injuries and situations that I have, health situations, and get the type and amount of help, treatment, medication, referrals, whatever, to address those priority elements for each of the individual treatment plans, but integrate them into an overall integrated, combined overall treatment plan where the priorities of each treatment plan are taken into consideration and logically and sequentially integrated into an overall treatment plan where all those priorities, whether you dealt with testing or referrals or treatment or meds or whatever the case may be, are put into a logical sequence in that schedule, in the patient schedule. And you did all that for me. You made that happen, and I got where I needed to go. Had to keep me going until I got the right surgery, and now I'm still getting good PT that you hooked me up with, the VA's PT clinic. And I'm getting stronger, and I can walk. I can walk again. My muscles that weren't working in my right leg have come back to life from that surgery. I'm getting them stronger and more endurance with them every day. I don't need my walker to walk with. I can walk just fine, and I can walk a long way. Go to all my appointments in the VA in a single day if I have multiple appointments. I don't need the wheelchair. I don't need the walker. But I take my walker because I still have those weird fainting spells, and I need some place to sit down instead of fall down. So when I feel one coming, I stop, put the brakes on, and I sit down. Okay, in my walker. Okay, I don't need it to walk. I can walk just fine now. Stairs are still a bitch, but that's mostly because I'm blind and I have no depth perception. But I want the VA here to keep making more of you. You can help train and develop them yourself, but you need to get on board that there's thousands across the country of military veterans who are messed up have a lot of issues, okay, multiple issues and multiple injuries, mental health problems related to not just their PTSD, but to their current conditions and their quality of life is so bad, okay, just like me, like mine was. It was just so awful, okay. I couldn't. I didn't want to keep going, okay. I didn't want to keep the misery, okay. And I want those good veterans, okay, because they're good people, okay. They raised their hand, they volunteered, raised their hand in front of the flag, said the oath, and they went places that we sent them, okay. I was there with a lot of them, okay, and I want them to feel better. I want them to feel what I now feel. Okay, I haven't lost hope. I'm very much encouraged, and that's why I wrote this. I want this VA here in Leavenworth to train and develop more folks like you, and put them out there to help guys and gals and veterans like me. I don't want this to go all the way across the country, and
it is going all the way across.
Well, it needs to get more. It needs to be bigger and better.
Yes.
Okay.
And it is happening.
Okay, good, because that's what I want. That's what I want. I want everybody else that needs this kind of help to get better too. Okay.
Can you tell everybody how long we've been working together in this role? Do you remember?
It was like sometime around Christmas, maybe. When was that?
It was actually, I think it was February.
February,
When we
okay.
actually started.
Yeah, I remember you telling me we were going to do this, and maybe
Yeah,
then
we talked about
we
it,
talked
and
about it,
then
but then
we were
yeah,
in the
so
process.
we were it was February,
Yeah,
but
so about 5 months.
yeah,
5,
but I
6
mean,
months.
but in the meantime, those 5 months or
Well, we
whatever
were
it was.
already working together
You're right.
as VIST coordinator.
Correct.
But
And that's
in
how you
this
saw me.
capacity,
If I hadn't been going blind, you would have never seen me.
Mm-hmm.
You would have never understand my challenges. You would have not had the charity in your heart to say, I'm going to help this guy, and I'm going to be a lead coordinator, case manager kind of person, and I'm going to get this trooper the help he needs, and I'm going to put him on my back, and I'm going to carry him to the finish line where he gets that damn surgery and feels better. That's what you did. You carried me.
Well, we did it, and we did it with a lot of help.
Well, I know you, but you
got
got
a great
the help.
team.
You got the help from me. You put that team together. You understood what I needed, and you got the team to do it. And you got them all together. You all got them on the same page. They all understood. It was a joint, combined arms effort. Okay, to fight all the injuries and all the issues that I had. They all came together and said, we're going into the attack, and they did. And you led the way. You showed them how to do it. You put the plan together. Like I said, you have been a great battlefield commander. So.
Well, I'm glad you're doing better. That's what
I
counts.
am, and it's because of you. And I can't tell you how much I sincerely appreciate you and love you from my heart. You're like a big sister or a little sister. You're like a sister to me. You really are. You have no idea how much I appreciate you, Don. You're the bomb. Okay.
I appreciate that, and I'm glad that you're doing better, and that's what matters.
I am, and you did it. So God bless you, and the VA and all those that you incorporated to hired up and rounded up to help me get better. Thank all of them, every single one of them.
I will.
Yeah.
Well, thanks for sharing your perspective and your story.
Well, it was a bad story until you got involved, and now it's a good story. And I want that good story to happen for anybody else like me. Okay, that's what I want. So thanks, Don.
You're welcome.
You done good. You done good.
You're doing good too.